because we don't have a lot of time and we want this to be meaningful for everyone. So, welcome to our SLP Consortium for Coastal GLRS. We are so excited to have all of you here today. Um, as we get started, I wanted to go over the meeting agenda with you all. So, I have it up. And first, of course, this is the welcome. And we're going to do a bit of a roll call with an icebreaker. And then we're going to have Amanda Major. She's going to talk about speech language services for students with autism. And then we are so excited to have Evelyn Dixon with us today. And she's going to share information on some hot topics for SLPs in our region. Then we'll talk about virtual classrooms for SLPs. We'll have time for some resource sharing before we close out for today. So please feel free. It is a Lunch and Learn consortium. So if you can feel free to eat your lunch, have your beverages while we're waiting and while you're listening. Please feel free to ask questions and place those questions in the chat as we go along. Amanda and I will be looking at the chat during the session today, and we'll be able to address those questions. So while we're waiting, for an introduction, if you can please place in the chat your name and what district you work in, and for the icebreaker. I know today is hump day, and been working with our students. So I know we always have those funny stories of something that students have said because they always say the darndest things. If somebody can volunteer and put in the chat something funny that one of your students said this week. And while you're doing that, I'm going to stop sharing. So, Amanda, if you can read a couple of the comments, if somebody shares, and then I will give it over to you so that you can get started with the important information you have to share about autism.
For sure. So far we have mostly people checking in with their name and their district, but I have a few. I've got here, Burdell, your new glasses are runway. That's cute. And then we have somebody who was asked if they have a mom or dad.
We're ancient, right? In their eyes.
All right. And I'm going to go ahead and share my screen. Oh, here we go. We've got another one. It says, working on multiple meaning words. Give me 2 definitions of the word fire. 1, bright and hot. 2, looking cool, like looking fire. That's a good one.
Yeah.
All right. Can everybody hear me?
Yes.
Okay, good. All right. So again, my name is Amanda Major, and I'm one of the program specialists here at Coastal GLRS. But this is my first year here. And my job here is to provide training and technical assistance to schools throughout our region. But my previous position was with Savannah-Chatham County Public Schools as an autism specialist. So I'm probably a familiar face to many of you. It's nice to see you again. If you haven't seen me before, if you attend other trainings with us here at GLRS, then you will certainly see me again. So today my goal is to provide you with some quick background information on autism and give you some just good, easy, simple tips and strategies for providing effective services to them. And this is my mini agenda within our larger agenda. I'm going to provide you with an overview of the definition and characteristics really quickly, and then relate it back to your roles and responsibilities as an SLP serving this group of students. Sorry, I had to admit somebody. And then we're going to talk about some eligibility considerations for the school setting and go through those tips and strategies for having more successful therapy, including talking about some of the behavioral barriers and some strategies we can use for more successful service delivery. So take a moment to read this quote by Mary Lynch Barbera. And then if you could in the chat box, just give me your thoughts. That might be agree or disagree. If it made you think of anything, just kind of your response to this. Got some yeses here. Okay, so yeah, mostly agrees, 100%. So to me, this quote really emphasizes the importance of you all's role as an SLP. But also from experience, I know that the SLP cannot do this alone. An effective program for students with autism requires collaboration. So as I'm talking about some of these things, it may feel a little overwhelming or daunting at times, but collaboration is definitely going to be key when we're talking about the educational team for some of these students. So I'll kind of go back to talking about collaboration throughout this, but if you have questions, if you want to jot things down to talk about later, or you could just chime in and put it in the chat box while we're talking. So the core features of autism spectrum disorder involve impairments in social communication, in language and related cognitive skills, and behavioral and emotional challenges. And these core features are influenced significantly by the developmental language acquisition at all levels of the disorder. So in addition to these features, you might also have sensory issues, feeding issues, and just knowing that all of these things are going to be present for students with autism to some extent, but it's such a diverse group. Some students with autism are going to have very significantly impacted cognitive and language impairments, while others are going to have above average cognitive and language abilities. But regardless of these differences, these core characteristics and challenges will have an impact on the development of those critical social communication skills. So just because a student has language and is able to speak doesn't necessarily mean that they're able to socialize or meaningfully participate in their educational experience. But that social communication piece is a requirement for a diagnosis and for that special education eligibility. So kind of by its very definition, these students are going to have those communication needs. This chart contains some of the core signs and symptoms of autism. I'll give you a second to look at it, but it looks at impairment in social communication, language and related cognitive skills, behavior and emotional concerns, and then those sensory and feeding challenges. Specific deficit areas are going to vary student by student because no one student is going to have every single one of these signs or symptoms. But it's evident that the majority of the students who qualify under these are going to have some level of communication needs and will likely require services and supports from SLPs. The nature of the disability and its educational impact is going to be what determines the type of service and the degree of those services. Note those top two boxes. the impairments in social communication, and then the language and related cognitive skills. Those are probably the most relevant to SLPs. However, as service providers, we really have to consider the information in all those boxes because students' behavior is communication, and inappropriate behavior is often the result of communication deficits. So when working with students who have sensory challenges, in addition to those accommodations and modifications that they might need in the classroom, in the therapy setting, there's also that responsibility of teaching students to make requests and self-advocate, because those are the things that are going to be necessary if they're going to be able to independently meet those emotional challenges or those sensory needs. So communication is really tied to all of those areas. And then there's just typical reward systems and reinforcement that is used in the classroom that you might use in therapy may not work for students with autism, especially if they've got those sensory and feeding challenges. Inappropriate behavior responses to food or sensory stimuli can make the therapy session more difficult. And it could probably be prevented, if only those students had the words to communicate that discomfort or disapproval with something. So, in short, SLPs play a critical role in developing the IEP and providing the special ed services to the students beyond their therapy. So, for students with autism, school-based SLPs screen and evaluate. They do the assessments. They may also do the assessments needed for augmentative and alternative communication, or AAC. How many of you have a student that you serve currently who uses AAC? You can raise your hand or you can just say yes in the chat box. Someone said they have 3. I've got a couple hands up. Yes. I think that's becoming more and more common. SLPs participate as a critical member of the IEP team, planning to determine the appropriate educational services, helping develop those speech and language goals that focus on language and on literacy, in addition to those speech-related needs that many of these students have. You guys help teachers and students with self-regulatory and social interactive functions so that they can participate in the educational setting as much as possible, whatever that setting looks like for them. You provide treatment, documentation, appropriate dismissal criteria, progress monitoring. You also train the student and often have to train their parents and their teachers and their paras on those devices if they use them, or on the communication methods that you're using in the classroom. And then I know you also talk a lot to families. You counsel them and inform them on their child's needs and what they can do to support their child or prevent further complications. On top of all that, you're expected to advocate for your students, stay on top of the research, know the best practices, and that's a lot. It really is a lot. So I just want you all to know that we recognize that and we appreciate each and every one of you. Knowing some of these students can be our most challenging for sure. Their parents often seek the most support from us, the most of our time. They have the most questions, but working with them really can also be the most rewarding, and there can be a lot of payoff in the end. So my hope in this session is that you leave with something that's going to make your job a little easier, a little more enjoyable during these challenging times. And that's really our hope for the entire session, beyond my little part talking about autism. All right, and I just lowered you guys' hands so that if you have a question, you can raise your hand again. So within the public school setting, eligibility for services is based on that definition under IDEA. students who've been diagnosed formally with autism, that's going to be based on that DSM-5 criteria. So you may also have students with autism who don't have autism eligibilities. Those students may have SDD because their eligibility is not autism yet. They may be served under a cognitive disability, an intellectual disability, or they might even be served under OHI if all they have is that medical diagnosis. So we know that even when we look at our caseloads and we see we've got a lot of students with autism on those caseloads, it's really a higher number than that because we've got students with autism who that is not their eligibility. And then just note that students should not be excluded from services based on any of these, which are cognitive referencing, which is just comparing their language scores to that IQ score, chronological age, meaning you can't be too old or too young for services unless you're exiting school or aging out. The diagnostic label, that you can't say that communication is part of their autism, so they don't need speech. Absence of cognitive or prerequisite skills, that really means you can't be too low or not ready for speech language services yet. All of those, the reason is that the research doesn't support that. The research really shows that that early intervention is important. And the research shows that even our students who have, those intellectual disabilities really can benefit from the services that you guys provide. And in some cases, the language skills really can grow beyond what that IQ score is. We also can't say that failure to benefit from services is a reason for them not to have it. This means we just have to revise that plan for that student, not necessarily just stop providing the services. And finally, this is an important one right now in the current climate. We can't not provide the services due to lack of funding or adequately trained personnel. So that's when, as districts, we've got to get creative. We may have to be providing some compensatory services, hopefully not, but I know that we've got contracted SLPs, that sort of thing. So now the important stuff. In the next few slides, I'm going to be sharing some tips and strategies for providing effective services to students with autism. We talked about this a little bit already, but the first is to use that augmentative alternative communication. This includes any type of communication that's not speech in order to replace or supplement talking. It uses visual or tactile means to communicate, and it's not only for your students who don't speak at all. AAC intervention can be used temporarily as a tool to help students increase their existing verbal output. So those students who have a few words, but maybe they just don't have total functional communication. Many parents express concern sometimes that using any of these types of AAC, the sign language, using the textbooks, anything like that, might delay the student using verbal speech, which of course is what they prefer. But just know that the research really doesn't support that. We need to really educate our families because the research says that children as young as 16 months old benefit from accessing AAC. At that age, that AAC is going to look a little different than when they become school aged, but it really supports giving them the tools they need as early as possible. Early intervention increases the likelihood that the student will benefit from it and use it functionally eventually. Sign language, picture communication, and voice output devices can and should be paired with that oral communication to the maximum extent possible. So if the student has verbal skills at all, we want to pair those with these things in hopes that this is just a stepping stone for them to increase that verbal communication. And of course, choosing which system should be dependent on the student's age, the student's ability, any impeding behaviors, their strengths and preferences, and of course, that input from parents and caregivers, because we want them to have a tool that they're going to be able to use in the home and at school. Next is to encourage functional communication. So functional communication training begins by teaching students the words that they're going to use or need the most often. The SLP, the teacher, and the parents can capitalize on those students' specific interests. And we know that many of our kiddos with autism, they've got a lot of specific interest, things that they are fascinated with, that they want to talk about, that they use all the time. And functional communication starts there. And it uses that interest to motivate the child to participate more in the therapy or just in the teaching. Another area or another idea behind it is that all behavior, including that difficult behavior, is a form of communication. And an important principle of it is that if you teach a student another way to communicate before trying to change that behavior, then the student won't need that inappropriate behavior anymore. Otherwise, if we don't do that, the student's left without that behavior they were using to communicate or a new way to communicate. So in other words, like if you had a student who grabs the teacher's arm and drags them to the door because they need to go to the bathroom, functional communication would use that moment to teach them the right way to make that request. So that might be having a visual on the door. It might be having a switch at the door that the student could hit and it says bathroom, please. Something in that moment to teach them the right way to communicate that need. Because if the teacher just simply says, stop, nice hands, don't pull me, but doesn't teach them to make the request, then the student doesn't have another way to request to use the bathroom. And they may even start having accidents. If they do listen and they stop pulling and they stop doing that, then they don't have a way to communicate it. Or more than likely, they're just not going to stop pulling you and dragging you to the door and grabbing you. So when you hear this term, it's really a term that comes out of like applied behavior analysis. That's what it means. It's using those opportunities to teach it in the moment and give the student a tool to use to use their words. So it encourages people with autism to learn language by connecting the words with a purpose. And it teaches them that their words are powerful and help them get the desired objects or results. Sometimes with those social deficits, us adults who place demands all day are not the most reinforcing thing to these students. So it's using the things we know are. What are the things this kid is really motivated by, and pairing those things with that language. So it doesn't focus on words as labels only. It teaches why we use the words and how if they can make requests and communicate their ideas, life is going to be a little easier for them. School's going to be a little more fun for them. And just a side note, if you are ever in an IEP meeting and there are behavior analysts there, behavior specialists, or even some autism teachers, and they use words like verbal operants, all that means is thinking about words according to that behavioral function the student's using them in. And I'm going to send you guys some resources for that, but I'm not going to get into a lot of details on that part of it. For the sake of time, but you are going to get a couple links here on the slide and just a couple handouts if that's something that's of interest to you based on the students you teach. I know some of you probably have like autism classrooms in your buildings, where some of you don't, where most of you probably serve students with autism. So that's kind of getting a little heavier than we're going to get in this session, but it's something that we could work on in a future session or at a SLP fireside chat, which we will make sure you guys all know about coming up soon too. Here, so I'm going to show it here. All right, this is just an example of some of the words that you may hear when we're in an IEP meeting and you have a behavior analyst talking about goals. You may hear words like manned, especially, or tact, but this is just showing a really simple version of what that means, and you guys will get this slide. And it's different functions for the word cookie. So imitation, as we know, imitation is an important prerequisite skill for teaching all types of things. And so the example here would be the teacher would say, do this, and the student imitates, picking up a cookie and putting it on the plate. Mand just means to request. That's one of the first things that they would be working on in a behavior program or in a verbal behavior program. Echoic is just repeating it back. Sometimes with students, that's where they're going to start just working on those speech sounds, especially, or volume and pitch. Receptive means the same thing in ABA that it means for you guys, SLPs. It's identifying things, following directions, just understanding what you hear. Tact means label. So that would be they show them a cookie and say, what is it? And the student answers. Or introverbal is those conversation skills, making comments and asking questions, answering questions, conversation skills. Honestly, if you are in a meeting and the BCBA or the autism teacher is using this type of language and you don't understand it, I would advocate in that meeting for them to maybe explain it in a more parent-friendly way, because if it's frustrating or confusing to you, it's certainly going to be to parents. But I know from personal experience that these words appear sometimes in the IEPs or just in the reports that you get on these students. So I thought just giving you guys this is kind of a handout along with the links I'm going to share would be helpful. All right. And so another strategy is to provide training and support to other adults, not just adding more speech minutes every time something isn't going the way that parents or teachers or you want it to go. One of the most common requests from parents is more speech time in any IEP meeting, but especially with these kids with autism. It makes sense because communication is typically one of their biggest barriers to all their other areas of learning. And the SLP is the person helping their student communicate better. So in their eyes, more time with that person equals better communication, right? We know it's really not that simple. If the speech therapist teaches a child to communicate with him or her in that therapy setting, in that room one-on-one, that doesn't necessarily mean that those skills are going to carry over and they're going to communicate to their teachers and their parents and their friends in the same way. This goes back to one of those characteristics that we talked about in that first chart, and that's having a hard time generalizing skills or applying those skills to different people, to different places. So simply adding more speech minutes isn't always going to be the most effective way to assist that student. Not to mention, it's just not always a feasible thing to do. They're going to miss other educational opportunities. There's just a lot of reasons that that's not going to always be the most feasible route to go. So therefore, rather than just adding minutes, the SLP should help train the other adults that interact with that child to do the same types of instruction, the same types of prompting and modeling, using the same visuals or the same tools that you use in that therapy session. And occasionally, when it's possible, encourage those adults to observe you during therapy, especially if the reason is they're not carrying those skills over in the classroom. If they're talking about, I can't get him to answer questions. He doesn't even answer what questions. And in your therapy, you're already working on why questions. Then it might be helpful to have the people who work with him watch the way that you're working on it, pulling some of those tools that they've already mastered with you into that classroom so they can use those with someone else. That is really what's going to help them generalize those skills. And then by doing that, the student's just a lot more likely to make faster progress with their communication skills because they're getting that same instruction from multiple sources in different environments. And it's not only like more practical for you guys because your caseloads are large, it's also the most effective way to meet the needs of these students. And then also integrating that speech therapy across those settings. So in addition to the individual and small group therapy sessions that the student gets in your office, they're going to benefit from having those strategies carried over into their classroom, into the cafeteria, onto the playground at home, especially if those goals are social in nature, because that's where the people are. This will allow the child to practice the speech with the teachers and peers and learn that socially acceptable behavior. Some of the time, you may not see the same kinds of behaviors or the same kinds of struggles that the child has when they're with you, because your office is quiet. You don't have the same distracting materials, or it may be the opposite. The classroom may be better suited for that student, and you kind of have some struggles in your office because they're rummaging through your things, or they know you've got lollipops and that's all that they can like be hyper focused on. So you also kind of moving to their setting sometimes might be a helpful strategy. And again, just like the last slide, it also helps those adults because they're able to see how you work with the student, observe your methods, and really just use those same, like using those flashcards, using those questioning strategies. All those things are going to be helpful and make the classroom a better experience for that student. Integrated speech therapy boosts the student progress and increases their ability to generalize those skills that they learn in that formal setting across settings. And that's when the parents are going to see that the students are also using that language more at home. This is going to help students do things in the classroom and access it more by learning to listen to their teacher, ask questions, answer questions, take turns, playing appropriately, talking to their peers, participating in groups. Like, I know it's not always possible, but if you know that it's like a group activity going on in the classroom, that might be a good time to kind of go in and work on some of those social skills. And then things like figurative language or managing conflicts. It's just any of those things that that particular student is working on. The functional way to work on that would be naturally in that environment. And I have something in the chat box. So it says, I like the idea of having a child with autism work on a skill within the classroom he or she has mastered during speech. Exactly. That's where I would start, I think, is the things that you know the student can do, the things they've mastered with you, and they've shown a lot of progress with you. Having the teacher take those things into the classroom and work on it there is that beginning stage of helping them generalize those skills and understand this isn't just what I do for Miss Williamson to get a lollipop. You know, they need to learn that this is what they do to communicate. And that skill doesn't come naturally to a lot of kids on the spectrum. They're really black and white. They need to understand that their words have power beyond that first tangible reward that they got for it. All right, and this is to address common problems as other areas improve. So on top of those language deficits and social skill deficits, we know that a lot of students with autism also have those speech issues like articulation, fluency, errors in grammar. We've got students with apraxia, those types of things. Often it's easier to kind of tackle those language problems and those bigger problems that are causing the behavioral issues because they don't have a communication system first, and ease these other skills in as that improvement is coming. I was a K through 2 autism teacher, and I had a student who loved to go to speech. But when it came time to start working on speech sounds, his belly hit the floor. And he was like, no, thanks. And he would like put his fingers in his ears. And when she tried to do L's, he'd stick his tongue out and go, oh. And it was just, there was a problem. And I think because it didn't have a reason behind it to him. Where language, it was easier to work on because he's getting something. He understood that if I use my words, I'm going to get something. But those sounds, that doesn't necessarily come together. And it just might not be the biggest battle to fight yet. Sometimes that is what parents ask about because, to them, they want their child to sound age appropriate. But talking about, they have to have something to say first. If they have more to say and they're talking more, you just have a lot more opportunities to work on those speech sounds. But that doesn't mean when you're labeling, you're labeling items and they need their R's, you can put some things that start with R in the things that they're labeling. So you have those opportunities to work on it. But I just wouldn't fight this battle until you're really making some progress in those other things. And I have something in the chat box from Tyler. It says, language and working on a communication system should be first priority always. And then many speech language pathologists and other related service providers, definitely OTs, definitely PTs, just other people, will experience some challenging behaviors during that service delivery, especially when it's new, because our kiddos don't like change. They like a pattern. They like things to just kind of go the way that they learned it the first time. And those transitions are really hard. And also, a lot of the time, SLPs just don't have as much training. They're not included in the trainings that the school's providing for behavioral support for students. So one thing that I'm going to do here, again, for the sake of time, is when you guys get the handouts, you're going to get an article that goes into detail about these things. But I just chose two kind of easy to implement strategies that can be adapted pretty easily based on the student, that are both evidence-based, and it's using visual activity schedules and behavior-specific praise. The visual activity schedule, it's going to help reduce that transition anxiety. It's something the teacher can introduce before they ever step out the door with you. First, you're going to go to speech, and when you get back, you get some time on the iPad, or it's recess time, or it's lunchtime. But then you can build the schedule for your session within that. So the student knows what they need to do. What are those expectations when they get there? And always have something reinforcing at the end. Whether for some kids that might be back to class. If it's a student who doesn't like to go and that's the struggle, showing them that at the end they get to go back to class would be a great way to show them what they need to do to get back to class. But also any tangible rewards that you use, any like games or activities, just having those things on the schedule so they know what entails. It's not just about what am I going to get, it's also about easing that anxiety that's just part of that disability. And then behavior specific praise is just giving them those positive statements that are very specific. What are they doing right? And pairing it with those rewards. So there's going to be some links to some examples. There's actually some videos in the handout I'm sending about those. But the good thing about the article, and the reason I picked this particular article, is it's specifically targeting behavior strategies in the speech therapy session. A lot of that information out there is about the classroom, and it's different. This article was written, it's by someone named Chow, specifically for strategies and using them in the speech therapy session. So if you haven't used these strategies and you're struggling with kids behaviorally, I think this is a good place to start. Countdown timer visuals helps too. Absolutely. I was very dependent on timers with particular students, not all students. And those countdown timers are good because they don't require a student to have that concept of telling time or understanding how long 30 minutes is. We know, especially with little kids, autism or not, you can tell them something's in 30 minutes and they're going to ask you a million times because that's just too abstract. So if you haven't used a visual timer, that's something I can actually include in the resources, because there's lots of them that are now apps or like a website. And it's just a timer that as the time is running out, it's getting smaller. So our kiddos are very typically visual learners, and it's tying that visual so that they can kind of see about how much time is left. And then collaboration is probably the most important point when you're dealing with these behavioral barriers. If there are strategies that the teacher implements successfully in the classroom, if they already have a token system, if they already have some kind of reward system in place, take that with you. I know a lot of the time you're going to kind of have your own system within the speech room for most students. Maybe they get a sticker each week to earn a reward, or, you know, everyone kind of does something differently. But if this is a student who is in a self-contained classroom, or this is a student who has a behavior intervention plan in their IEP, those systems may trump the system you have in your classroom. And that doesn't mean to exclude them from your system, because ideally we want them to generalize that behavior and learn the different systems. But if they're not there yet, they're not there yet. And you need to use what they're using in the classroom, because that's what's working so far. And so that might be, they work for nickels in their class and they've got those little nickels on the Velcro. Take it with you. Tell the teacher, I need a copy of this, or can we just bring this chart with us? Because that already has meaning to the student and you're not trying to recreate the wheel. And then finally, just remember that one difficult therapy session with a meltdown, or, you know, something doesn't go right, is not a failure with these students. The people working with these students all know that these things happen, and a lot of these students just need repeated exposure to that new person, that new setting, the new expectations. You may have not had issues previously with the student, but now you're ready to work on questions without visuals, and suddenly you have protest behavior, and it's because suddenly it's hard, you know. So sometimes you may have that rapport with the kid, but new expectations bring new behaviors. That's to be expected. So if things aren't working out, don't be afraid to reach out to that student's teacher or their para or their parents or any behavior support people in the district. Just like they need your help in the classroom with communication, you might need theirs, and that's okay. It's supposed to be a team effort. So if you are struggling, advocate for yourself. Don't just kind of suffer through it and feel like the wheels are turning and nothing's really changing. It's the reason that this is a topic today is it's not just you. Just know that. All right. You're going to receive my contact information with the slides. I'll be the one sending it out. So if you think of questions or you have things about a specific student maybe that isn't appropriate in this video, you're welcome to ask me questions. If you have questions for the group, this is a good time for that. And if not, I'm just going to turn it back over to Ira. You're welcome, Tyler. All right, you're welcome, guys. I am going to turn it over.
Thank you so much, Amanda. What a wealth of information there for everybody. And again, we will be sending all these resources out to everyone. So now we are going to transition and have Evelyn Dixon come on and share with us. Welcome, Evelyn.
Can you guys see me? I'm sure you saw me earlier playing with the backgrounds. I usually don't meet on, I think this is Google, but I was just exploring the backgrounds. But good morning. Well, yeah, still good morning, everyone. Amanda, that was an awesome presentation, a lot of great information. It kind of brought back memories from when I was practicing. And I did have oftentimes a group or a self-contained unit at the in the district or at the school that I was working in. So those are a lot of very helpful tips. But good morning, and thank you, Ira and Coastal, for having me today. I appreciate this. It's always a joy to come and talk to the SLPs about and try to answer questions and try to tackle whatever concerns we may have around the state of Georgia. So with that said, I'm going to go ahead and dive into my presentation, if that's okay.
Yes, please.
Okay. All right. So as Amanda is getting the presentation and pulling it up for me, I do want to give another thanks to Ira. I'm not sure if she shared with you guys, but we have been very successful with reestablishing the consortiums around the state. I'm so proud of them. They just, Ira as well as the other SLP leads have just kind of taken it and just ran with it. I did mention to the GLRS directors that we started with, I think, 6 in the beginning, and now we're up to 15. So we have 18 GLRSs, and initially before this, we only had about 6 to participate, but now we have 15 participating, or maybe it's 13. I think it's 15. But I can't remember. I can't remember which one. But either way, I have about 5 maybe it's 5 that's not participating. So I have 13. So that's awesome, because this is so needed around the state, because oftentimes information isn't trickled down to you guys. And we want to make sure that you're getting everything, that you're updated with the latest information, the latest guidance that's coming out. So this has just been wonderful. So again, I can't thank you enough for this, Ira, for just agreeing to be the person to lead it for this year. So thanks again.
We are definitely excited in our region, and I'm so glad we have a good number of people in attendance today.
Yes. So with that said, Ira and I talked a little bit, and I know she had you guys to submit to. Randy said for sure, spreading the knowledge. There were some questions that came through, and we kind of selected maybe like 4 topics that we could talk about, because we had to also factor in time in terms of the things that we felt like was kind of the top one. So we wanted to do that. So with that said, Amanda, would you advance the screen for me? Okay. So those topics for discussion, we wanted to talk about dismissal considerations, eligibility for the speech or language impairment program, consult versus consultative, and then just LEA control. And I'll talk just briefly about that at the end. So let's go ahead and dive into dismissal considerations. And I kind of hate to call them dismissal considerations, because they're really reevaluations to determine whether the child continues to meet the eligibility criteria for speech or language services or any other services that the child has qualified for. So you can advance the screen, Amanda. So what I always like to say before we even start about talking about dismissal or reevaluation, because I think there's a myth around the state sometimes that feels like speech is exempted, or speech and language impairment eligibility is exempted from doing certain things. But that is not true. All Georgia special education rules and IDEA regulations for evaluations, reevaluations, and eligibility apply to the speech or language impairment eligibility category. So I just wanted to put that out there so there's no misunderstanding about it, but that is a fact, definitely not a myth. I'm not sure why it's not showing up as a hyperlink, but if you don't have to click on it, Amanda. They can, have the presentation. But if you click on that hyperlink, it will take you to the rules and regulations, or the state rules as it relates to the speech or language impairment program. And it kind of talks about that in there as well. But I just wanted to put out there that we are not exempted from following any of those rules. All right, next slide. So let's dive into dismissal consideration when we're talking about speech as secondary. I get a lot of questions at the state about, well, if I'm secondary, can I start the reevaluation process to look at whether this child continues to meet eligibility for speech and language services without having to bring the school psychologist in, or anyone else in? Or a lot of people say, well, I want to look at possibly the reevaluation for dismissal of services, but the case manager is saying, no, we can't do that because we're not going back through this process again. Well, that shouldn't be happening. And if you're in a situation where Speech is secondary, and you have this reevaluation meeting. And during the reevaluation meeting, the IEP team, which you're a part of, decides that the existing data for, and we're using EBD in this example, is enough to determine continued eligibility in that area. That's fine. You can't do anything about that. That's what they decided. That's fine. But you guys require additional information to determine whether SLI continues to, or the child continues to meet the eligibility status or criteria for SLI. That's fine. The team can move forward. All right. So the next bullet talks about anytime that you are completing or conducting any type of formal evaluation for a student, you have to get parent consent. I get a lot of people saying, well, can I just test a child? Absolutely not. You have to get parent consent before we can test or provide any type of formal or informal assessment, especially in terms of eligibility for looking at maybe IEP goals and objectives. You have to get consent. So you'll get that parent consent. And while you're looking for to determine whether speech and language services are, required, or the child continues to meet eligibility for that, if you see that other things are going on, that doesn't stop you from looking at those other things, not necessarily you, but bringing in those other individuals. Like if it is, of course, in this case, it wouldn't be behavior, but what if it's something else that's going on with the child? This is your opportunity to do that. So don't think because you get the parent consent, you can only look at speech and language. You can look at other things that may be of concern, if there is a concern. So you look at that information, you looked at the review, you reviewed the existing data, and now it's time for the speech language pathologist to complete her formal assessments. Of course, based on our rules, you only have to give one formal assessment in the area that you suspect the child is having problems with, and informally look at the other areas. So you go in, you complete your formal assessments, you look at your informally at the child, and now it's time, after you've completed the assessments, to come to the table. That is an eligibility meeting, okay? So all of that information you guys talked about in bullet 1, that talked about all the existing data for EBD, and it was enough, that information needs to go into the eligibility report. Of course, you are not the case manager, so you need to make sure that you are communicating with whoever that case manager is, so that when you guys come to the table for the eligibility meeting, you can ensure that all that information is in there. But that should have been discussed at bullet 1, okay? So you're including all of that data, whether it's formal, you're going to include your formal and informal data in that report as well under our section. If the results of the assessment indicate that the child is no longer eligible or no longer meets that eligibility criteria for a speech SLI, you can dismiss the child. But the child continues to be eligible for special education services under the EBD eligibility category. Okay? So has nothing to do with the EBD. That still, they said they had enough existing data to determine eligibility. The information is in the report. But at this point, the child no longer meets the eligibility criteria for speech. Okay? Any questions before I go to the next scenario? See a question. Okay, that was just okay. And if you think of something later, we can always come back. All right. So the next slide is, I get this question a lot too. Well, Evelyn, this child is primary speech. The child gets no other services. I don't think there's anything going on with the child academically. And I'm ready to look at have a reevaluation to consider whether the child continues to be eligible for services. Do I have to bring the school psychologist in? What do I need to do? Well, at this point, when you come to the reevaluation meeting, as a speech pathologist and you are the case manager, you have to do your due diligence with making sure you have collected all the necessary data that you need to confirm that this child really doesn't have any academic or behavior issues. So when you're at that table, and you're discussing reevaluating that student, you need to have documentation to support academically and behaviorally that this child is okay. That can come from work samples, parent reports, state and district assessments, whatever it may be that you need. It can't be a statement saying, well, I talked to Mrs. Smith and she said Johnny is doing fine in the classroom. That's not enough information. You need to have documentation to support that there are no other concerns indicated in those areas. When you have that information, you need to hold on to it because we're going to talk about it again when we get down to the next few bullets. You have that information, you move forward because you want to see if the child continues to meet eligibility for SLI. You get written consent. Again, can't test a child without having the parents' written consent. Now, during that evaluation, if you suspect or see something else, don't say, oh no, I just have permission to test a child in the area of speech and language, so I'm not going to address that. You need to address it. If it's behavior, whatever, maybe your existing data or not existing data, maybe the data that you collected didn't give you all the information you needed, but you see some other things now. So if that is the case, you have the ability to do that while you are making sure that you, while you're completing your speech and language assessments. So you look at the child in the area that is suspected. You formally assess the child and complete whatever informal assessments for speech and language. If there are no other concerns noted, which you indicated, a referral to psychological services is not warranted if the team determines no other concerns. You are that team. That happened in the first bullet. All right, so you move on to bullet 4 and you come to the table. That is your eligibility meeting. And you know all of that great data that you collected, because I know speech language pathologists, we are like we are like the best data collectors and takers that I ever know. Like, we just have to make sure that we're using that information in the right way. But all that data that you collected, that goes into the eligibility report. Okay. And the reason why I emphasize this so much is you guys have probably seen it. We have a child that has been receiving only speech and language services. We go through, we have tunnel vision. We don't look at anything else, or we just say, Miss Smith told us Johnny was doing fine. We dismiss the child from speech and language services, and then 6 months down the line, this child is referred back again because they're seeing academic issues, okay? Sometimes that may happen, but I would rather for it to happen with you having all of your information in the report to support at that particular time, you didn't see anything going on with the child. Because first and foremost, we're trying to make sure that we meet the needs of the student. It's about the students and making sure we do our due diligence to make sure if there are supports and services that they need, they can get them. And then lastly, if your data, or your assessment supports that the child is no longer meets the eligibility criteria for SLI, then the child is no longer eligible for special education services under the SLI category. All right? Any questions? And if you notice this one, can you go back one slide for me, Amanda? If you notice on this slide, I indicated that speech was primary and no other concerns, because I wanted to kind of give 2 different scenarios of how this can go. All right. Now you can advance the screen. Thank you, Amanda. All right. Now, this is a situation where the child is primary speech, but there are other concerns. And clearly you can see that. You have been working with Johnny since he's been in the 2nd grade. And as SLPs, we know, we already know that, even if we have a child that has articulation and we start seeing some language issues, or the teacher saying that they're struggling in the classroom, at this point, when you come to the table, you collected all of this data. The teacher has told you the child is struggling. The parent has been concerned. The grade support that the child is struggling. Now, in blue, I noted that it says services and supports may be provided via the IEP before the evaluation process. That's purposeful. And let me say why. Once a child qualifies for any of the eligibility categories, whether it's speech, whether it's OHI, autism, whatever. If we know that child is a student with a disability, if we, while that child is under that umbrella of whatever category it is, see that the child is struggling in some other areas, whether it's behavior or whether it's academic, we can provide those supports. There's no such thing as, well, he only has an eligibility for speech, so I can't give him academic support. That is not true, because we are obligated because that child is a student with a disability. Now, what I ask people to do is don't withhold the support, but if you suspect that we need to start the reevaluation process because this child may have some academic issues, then you do that, but you shouldn't withhold the support. So that's why that bullet is there, because supports and intervention can be provided during the reevaluation process, and it definitely can be provided before. So of course, you're going to ask for written consent. Once you do that, the speech language pathologist will complete their portion of the evaluation, and the school psychologist and all other pertinent staff will complete formal and informal assessments for academics as well as other areas of concern. It could be the behavior specialist that you're trying to bring in. Timelines of getting the child tested. Okay, hold on. All right, I'll come back to your question. All right, so after the assessments are completed, the team reviews the assessments. This is the eligibility meeting, all right? If the results of the assessment indicates that the child no longer meets eligibility for speech services, they will be dismissed. However, the child could be eligible for another eligibility category. That would be based on whatever the results are. Or the speech language pathologist may go in and say, you know what, I've been working with this child for articulation, but I now suspect that he has some language concerns, and I did formally assess in that area. So while I may not address artic, I do need to address language with this child. So it could go either way. I just kind of put that scenario in there just for the purpose of this slide. So let me answer the question, or at least try. Cheryl, you asked, Evelyn, could you address timeliness of getting the child tested by the school, by the psychologist when he or she is a referral to a new program? Cheryl, could you unmute yourself and just, when you say referral to a new program, are you saying in this situation where we know that it's speech only, it's a reevaluation, and because it's not an initial, the school psychologist, it may take a long time or may take some time?
Yes, ma'am. Can you hear me?
Yes. Mm-hmm.
Okay, great. Yeah, so what's happening, and I don't know if it's happening in every school, but we're getting the statement back of, well, their reeval isn't due until 2 years from now.
Mm-hmm.
Okay. Is there a best practice? Because this child, I'm not working on math with this kiddo.
Mm-hmm.
And you're saying I can give the child goals and hours, but I just feel like this is taking too long. I know we've had COVID. I know there are a lot of initials. Children are coming out of the woodwork that haven't been anywhere, but it's just unacceptable, in my opinion, the time that we're waiting for these children to receive their services from other than SLI.
Right. It shouldn't. That's more of a practice thing. Honestly, IDEA doesn't have, like, with the initial evaluation, it says 60 days, but a reevaluation, they just require at least every 3 years. That's more of a trying to work out, having that conversation at your district level, your LEA level, just to see what they have in place for these situations, because you're not the first one that has said, hey, these types of situations are kind of pushed back because they're trying to complete the initials. And that is not right. But that would definitely be something to speak with either your direct supervisor about, or either the special ed director about, because we have to provide these supports. But in the interim, like you said, Cheryl, going ahead and giving that child supports. If it's math that the child needs, now the speech therapist shouldn't be providing the math support. That support can come from a special ed teacher. It can come from whatever the IEP team decides. But I want to make that clear. Even if it's behavior support, you can create a behavior goal, but it doesn't mean that you are monitoring that behavior goal. or that math goal. So just be very clear on that. So just like if we add a speech goal, that teacher wouldn't be in there implementing that speech and language goal if the situation was vice versa. So I know you'll probably get pushback from that because they'll be like, well, he's not on my caseload, but the laws clearly states if the child is eligible for whatever eligibility category and he needs services and supports, we need to be, the IEP team is responsible for making sure those services and supports happen. Okay.
Yes, ma'am. Is there any, as our 60-day timeline and then our 30 days for the IEP, that we could lobby at the state level to have anything changed for the RNPs? Just because, I have voiced my concern many times.
Yeah, I think that is something that I can definitely take back.
Thank you.
To the people here. I want to be transparent and let you know that it's probably not just happening there, because I've gotten similar questions before and the process being held up. And like you said, sometimes because of COVID, sometimes these things were happening before COVID. But I can definitely jot that question down and see what we can do to go back to re-emphasize that, because I think back in 2018, we had a lot of sessions with the special ed directors about this very situation and a re-eval and what constitutes a re-eval and what it should look like. So give me a chance to kind of talk to my managers or the people above me to see if there's another opportunity for us to talk about it again, to kind of jog their memory that this should be going on. But a lot of it is just procedures in districts where I don't know if they just haven't figured out the procedures to kind of help with these situations or what, but I definitely will follow up with that.
Thank you, Evelyn. I appreciate it. Or even pushing for funding for more psychologists.
I
know.
Yeah, I'm gonna leave that there, and I'll talk about that just as far as the funding piece and all of that, and just LEA local control. For the, from the local education agencies, but we'll talk about that in some of the upcoming slides, or my last slides on there about the funding and budget and all of that. Okay. But I do have the reevaluation piece down. All right, let me go to the chat. Randy asked, could you provide examples of supports via the IEP prior to reevaluation? It could be a child is having some behavior issues and they say, hey, I want to add a behavior goal, or I want to see what kind of supports we can put in place, for the child. You can add the behavior goal. It doesn't have to be in the form of a behavior goal. It can be whatever support, you need it to be. It can be, just like Cheryl mentioned, the child is struggling in math and you guys have already had that conversation. Okay, do we need to add a math goal where the special ed teacher needs to support that math goal? Somebody asked who would be responsible for monitoring. If it is a math goal and the special ed teacher is assigned to that, the teacher is assigned to implementing and monitoring or collecting data. But as the case manager, you are to kind of periodically monitor to make sure that those things are happening, because you are the case manager. So you're the person that's following up. If you sit at the table and you guys, as an IEP team, come up with whatever the supports are, then you may not be the one that's implementing it, but you are the one that's going back to monitor to make sure that it's happening. And Amy asked, then who is responsible? Okay, somebody, and then I asked for that. I'm sorry, it moved on me. Could the supports also be response to intervention? Let me say this. I'm not going to dive into anything with response to intervention or MTSS, not because I'm skating around the question, but because we are about to have a professional learning. And when I say we, I'm talking about our support personnel team at the state. And we are collaborating with MTSS to talk about MTSS, kind of our roles as speech language pathologists with that. So I want to hold off responding to any kind of RTI MTSS questions at this point. And what I will do is, I don't know, Ira, if you still have that link for that professional learning, but if you do, You can put that link in the chat so that
Okay.
everybody can register, or those who are interested can register, and then you'll be able to get those questions about RTI and MTSS answered in that session. So I'm not skirting around or, trying not to answer the question. I just want to make sure that everybody hears the same thing, and we're teaming with the MTSS unit. Okay. Cheryl said, thank you. Amy said, would that be, okay, would that be in the IEP? It would be in the IEP, Amy. Whatever changes, whatever supports you're adding, it should be through the IEP because it's a student with a disability. Yeah. And of course, what is the RNP? I'm sorry.
So RMP is a referral to a new program. So our district has a process and procedures in place to handle those where there's a better chance of getting the other team members to help with that progress monitoring and implementing those interventions for students. So that's a district process that's in place
Okay.
to help with that, because sometimes when people had it just in the IEP, then they were saying, well, I'm not getting the progress monitoring, or they're not getting the support if they weren't case manager. So it's a process to help with that.
So if that's the case, Amy, then of course you would follow whatever procedures for RMP, but from a state and a federal standpoint, it should be documented in the IEP. That's the first thing.
Ms. Dixon, so I've got several students that are in this boat. In fact, like probably 15 or 16 in my caseload that have math or reading or behavior or all of the above. And so the way we've done it is just in that section for academic strengths and needs. That's when we discuss in the needs portion, we would say, so-and-so student is struggling in the following areas. An RNP plan with the following interventions is in place in order to address the concerns in preparation for a possible reevaluation. And we sort of discuss it in that manner. But the IEP goals, like Ms. Williamson, like Ira just said, we were having issues. None of the teachers were putting in the data. And so, we can't chase teachers down for data. Right. But the RMP plan requires them to put in a point every single week, and it's monitored by our RTI coordinator, so we're here to keep up with.
Right, and that's fine. I'm definitely not saying don't follow procedures. I'm just saying that
I'm worried about the IEP goals, like who's putting that data in. So I just take the data from the RMP plan and put it in, and that's what I'm worried about.
I would say that the person that is implementing the goals should be entering that information into the plan. You're just monitoring to see if it has been it has been entered.
Okay.
Because I know that responsibility shouldn't fall on the speech pathologist to collect the data, to implement it and all of that. Your responsibility is just when you go into your RMP, if that's where you're documenting it at, to see if that person has followed up and if they haven't, then following up with those individuals. So basically what I'm saying for the question to Amy is whatever procedures you have in your district, that's fine. That's best practices. If that's not best practice, that's what the practice is in the district, that's fine. But from an IDEA and a state perspective, the only place you would have to document that would be in the IEP. But I get what you guys are saying. You went a step further because you felt like Ira said, if it's in the IEP, sometimes it's missed, sometimes it's not done. So it's just really another checks and balances that it seems like you guys are putting in your district, and that's perfectly fine.
I have one more question, and then I promise I'll let you move on. I'm sorry.
No,
I have 3 students that were all evaluated by both a psychologist and myself last year, and they were all sort of deemed slow learners. And so they did not qualify for full SPED support from SPED teachers, but they did qualify for speech intervention or for speech language impairment. And so what we kind of did, because obviously those students, even though they're considered slow learners, they still have very specific needs, in math and in ELA. They just didn't really have any strengths since they didn't fall into a category like SLI kind of thing.
Mhm.
And so we sort of kept their RMP plans open, and the teachers are still doing small group interventions with them. They're not receiving fed support, but we are doing, based on their scores on the psychological and on their receptive and expressive language deficits that we identified in the eligibility, we have implemented like testing accommodations and that sort of thing to help them out in those areas. So I'm wondering if I should take, like, I have another student that I got from another district that basically was the same situation, but she actually has fed support through her IEP. So with the slow learners and like that keeps kind of coming up, do you have any advice for us as far as how best practice and IDEA would look at that being in an IEP?
It's kind of hard for me to say because I'm so straddled the fence about that, because I do feel like, even though that child isn't or didn't qualify for any other area, we're still obligated because that child needs services and supports, and we can't not give it to them. I hate to use that double negative, I'm sorry, because they are a slow learner. I do think that what you guys have put in place in terms of continuing to provide supports the way that you were prior to the evaluation and the child being determined not eligible for other categories. I think as an IEP team, you can be as creative as you need to be, as long as you can support how you are supporting the child. So that's probably the best way that I can look at it, because some people may say, well, they're a slow learner, they shouldn't even be getting any types of additional supports from special ed. Maybe if you had asked me that probably 10 years ago, I would have agreed. But with looking at the child and the child being under a student with a disability, we are obligated to provide those supports. Now, how those supports look would be up to the IEP team. So that's the best that I can give as far as that. I do think what you're doing is fine, because the child needs supports. The IDEA doesn't say these supports should be a goal, or these support should be a support personnel. It's really left up to the IEP team in terms of how that looks. So yeah, you would still have to provide some support.
Thank you so much.
Okay. All right. Any other questions before I move on to the next slide? You guys have some great questions too, and there are questions that come up. Ira, I don't know if you attended. We just had a communities of practice.
Yes, I did.
And I'm just afraid it didn't get to everyone, where you guys can come on, and it was an opportunity not for really myself or the Alicia Mercer, who was our school psychologist at the state level, and then we have Elise James, who is our OT-PT person. She's not an OT or PT, but she's the person that supports OT and PT. And we have what we call a support personnel group. And so under that group, that's the professional learning that I was talking about that's coming up around MTSS and RTI, and pretty much kind of our roles. We're going to have something coming up in, I think it's April or May, for dyslexia. And then we also had one in the past hour, I'm not sure if you attended, on related services. So that is a good opportunity for you guys to kind of just come and, listen to some of the things or information that we have to share. But the communities of practice is what I was trying to say, is an opportunity for you to come on and just kind of not necessarily ask questions from us, but collaborate with some of your counterparts in other parts of the states, like you're sharing about your RNP, another county or district may be doing the same thing, and just kind of brainstorming and getting some ideas from them. So the next communities of practice that we have, of course, I'll get it to Ira, and then she could trickle it down to you guys in the trenches. But that is a great way of doing that. I think, Amy, I agree with RTIs. I continue both backwards. Okay. I will include the registration link. Okay. For the handouts you receive tomorrow. Okay. I will get the link that I'm talking about for the professional learnings that's coming up. Amanda, I don't have them just right here. I'll just have to give them to Ira. Ira may already have them, but I wanted to make sure the link that she has is a Teams link. Because we went from go to meeting when we initially did it, and then at the state we had to go back, or we went to Teams. So I think the link that I did send Ira is still the go to. So I'll get it to you, Ira. Okay.
Okay, thank you.
All right, Randy Austin. Evelyn, do you think it would be a possibility to look into adding another special education category like no. We definitely do not have that authority. That is definitely a federal program type of thing. I think, Randy, when you attend this MTSS RTI professional learning series, I think that'll kind of help answer your question about how we can support those students. Because the MTSS person is really good and talking about, all kids are in MTSS, whether they are a student with a disability or a general ed student. And she really, really paints a good overview of how that looks. So I think when you come to that training, it'll kind of give you some ideas about how we can address those students. But like I say, I don't want to spoil anything or spill the beans about kind of what we'll talk about, but that may help in answering that question. But I can answer the question about an eligibility category, and that's no, but that may help you with some of those slow learners. Randy, as well as Amy, with some of the slow learners. Okay, great questions, you guys. All right, Amanda, if you would advance the slide for me. All right, you can go to the next one too. We're going to talk about eligibility. And the reason why we kind of talked about this, because I think a few of the questions, there was a question that came in about ESOL, and I'm not going to dive into ESOL. And it kind of brought about talking about exclusionary factors and all of that. So what I wanted to do is I added the speech or language impairment eligibility rule. And Amanda, would you click on that hyperlink? Let me take them to that so I can kind of answer that question about ESOL and determining whether it's a language difference or a language barrier, and what our obligation is, our obligations are as speech language pathologists in terms of what we need to do. Will it work, Amy, the hyperlink?
Is it the top or bottom link?
The top link.
Okay.
With the top bullet. If you would click on that one, and then once we go through that one, I'll go through the other one. I'm hurrying, Ira, too, because I know you guys got stuff to do. Okay, if you
Now this is important, so
okay.
let's get through it.
Okay, so let's
We have our fireside chat coming up next month, so what we don't get to, we can finish up then. So.
Okay, so if you scroll down for me, Amy, please, and I'll let you know. Keep going. It's almost at the bottom. Okay, stop. Go back. Okay, right there, A. You see it's on the second page. Letter A. But can you go back up to show the portion of the letter? Okay, there you go. Keep going. Keep going down a little bit so I can see. There you go. And it talks about eligibility, and it talks about, how we need to document and have at least two or more measures or procedures, at least one formal. We talked about that evaluation in the area that the child may be suspected as having a disability. So in my conversation, we were talking about ESOL, and I said, well, I know our guidance kind of talks about that a little bit. It doesn't spell it out and say ESOL, but I wanted to show you where it is in our eligibility guidance. And it says a speech language disorder does not exist if environmental, cultural, or economic disadvantage cannot be ruled out as a primary factor causing the impairment. And the reason why I wanted to read that is because the question about ESOL and determining whether it's a language barrier or difference between a disorder, that is on you as a speech language pathologist. You have to do your due diligence. If I'm not sure, some districts have bilingual therapists, most people don't, but some districts have interpreters. When I practiced, I had an interpreter, and I usually had a go-to interpreter that I utilized And she and I would talk usually before the assessment, so she'll know if I'm asking her to do something with like the self 5, there's certain things you can't repeat. I can only say one time, so you got to say it one time. So we kind of had those conversations, but it helped me to be able to rule out whether it was a language difference or a language disorder. And that's important. You have to go to the table and know those things when you're at the table, because that's very important, because you definitely don't want to identify the child as having a language disorder when it's just a language difference. So I'm just kind of answering that question and letting them know that that is something you need to do, whatever your district procedures are in terms of practices are about how you utilize the interpreter. If you have bilingual therapists, that's left up to the district. But as a speech pathologist, you need to do your due diligence to make sure that you are ruling out that it's a language difference, opposed to just automatically identifying the child as having a language disorder. Okay? So Amanda, if you would go back to the PowerPoint, and if you click on the next hyperlink. And I told Ira, I said, I know when I'm asked a question, I like to dive in deep, and I like to go to the source of where I'm getting information from, so that you guys can have, just in case someone's asking you, you can refer back to that link or that information in terms of that. But this is just the special education eligibility requirement, period. It's across all eligibility categories, and it says that all eligibility categories include the following exclusionary factors. You guys know what they are. You've heard of them before. But if you look at the one at the bottom, the third bullet, it says limited English proficiency. So it goes back to what I was saying in what I showed you under the speech pathology rule. I'm just kind of showing you again in terms of eligibility, period. We should be ruling that out, because that shouldn't be a reason why we are qualifying a student for services. Okay. All right. If you go back to the PowerPoint presentation, any questions about that before we move on from eligibility? And I would encourage, which I know you guys probably do, pull it, save it as a link on your favorites, print it out if you want to. Print out the speech and language impairment eligibility category and be familiar with it, know it, so that when you are in any type of meeting or people are asking you questions, you are able to go back to the rules and the regulations and quote that and show them where you have it, so that you're not kind of cornered into doing some things that we know may be unethical, because you have documentation to support why you made a decision that you made, especially about a student that English is not the primary language. Okay. All right. You can advance to the next slide. All right. Consult versus consultative. And I actually should have sent you this document too. Can you go to the next slide for me, Amanda? So what I wanted to basically talk about here, there's a one-page document that I have. I'm not sure if I sent it to the leads or not, but basically it's for districts that are Go IEP districts. There is a way I could show you, but I won't do that. I'll have to step it out and send it to Ira and the leads, where you can go under Go IEP, and this document or this information is here. And what I'm referring to is
Excuse me, Ellen, some of them may not know what you mean by Go IEP for those districts that don't use it.
Okay. So Go IEP is the state IEP system. Okay. And it's not mandatory. Not every district in the state of Georgia uses it. I think we have over half of the districts using it. Maybe like 80% of districts do use Go IEP. But a lot of districts don't, and it's okay, because you can still use this document even if you're not a Go IEP district. Thank you, Ira, for letting me clarify that. So you don't have to. Or when I send Ira the document, it's just in a Word format, because I realize, as well as Linda Castellanos, who is over Go in our data, we realized that not every district is a Go IEP district, so we wanted to put it in a Word document so you guys could have as well. All right. So what I'm meaning by this is that Linda Castellanos, who is our data person, she does a lot with FTE and Go IEP. She was receiving a lot of questions from speech language pathologists. And of course, she referred them to me about, and it's not documented anywhere in the rules and the regs, but just talking about consult and consultative. But she was receiving a lot of questions about indirect services, okay? Basically, these are students, and you guys know them. They may be an autism student. No offense, Amy, but it may be an autism student. It may be a PID student, with severe, profound. It could be a more student that we've had on our caseload like forever, okay? And these are students that probably will continue to be on our caseload forever, but we can provide services indirectly. And what I mean by that is that a child can be eligible for speech and language services, but the IEP team decides how services and supports are rendered. Okay, let me say that again. A child can be eligible for speech and language services, but the IEP team decides how those services and supports are provided. All right. Eligibility does not dictate how the services are going to be provided. So, for instance, I have a student, a PID student. Probably no matter how many times we test the child formally and informally, they are going to have some language issues. Okay. But does that mean that the speech language pathologists have to provide the services? No, it's whatever the IEP team decides. So with that kid, let's just say we have a kid that is mild, MID, and we know that they're having some issues with vocabulary. I'm just throwing out some things now. And when we get to the IP meeting, we say, well, you know what? I've been working with Johnny for this for years and years and years. These vocabulary goals can really be addressed through the primary exceptionality, okay? And because of that, then the teacher and the SLP can either develop a goal, a communication goal, or they can implement it and embed it goal. Okay, so let's just say this child is working on, let's just say an SLD kid, and they're already working on reading comprehension. They can use that reading comprehension goal, and you guys use it as an embedded goal, however you want to figure it out. It depends on the student themselves. You'll have to make that decision. Say it's a communication goal for an autism student that truly is just pragmatic language, and pragmatics is not taught in isolation. We need to make sure that we spread the love, because if we teach it in isolation, that's the very thing we're doing different from the very thing that we say we want them to do when they get back to the classroom, because we want them to be able to transfer those skills. But let's just say the speech language pathologist doesn't really need to go in the classroom to see if that transfer is going on. The teacher can address that communication goal in the classroom. You guys have established that whatever the goal is, the teacher is monitoring that goal and that collecting data on that goal. Those services are indirect because the child is still getting communication services. So when it comes to FTE, and there's a section, I know you guys don't dive into FTE like that, but there's a section that says, what disability does the child have? So if it's SLD and speech and language, they're still going to have that disability, but you will not be charging or I don't want to say charging. You won't be sending anything in for FTE for this child. So we won't put a 3 there, or we can't charge for FTE. And I don't want to use the word charge, but you know what I mean. We can't report FTE. So with that said, those services are supported indirectly. So I'm going to see if I can share my screen, because I did pull up that form. So Amy, if you give me a second, I'm going to see if I can share my screen this time. Okay. It's just not happening. Okay. So Amy, I do, because I think in order for them to understand what I'm saying, I need to send you this form so they'll know what it looks like. and I'll say this, and I'll speed up, Ira, because I do have another meeting at 1 o'clock. Okay. All right. Let me know when you received it. And the reason I want to show it is because you guys can keep it. I don't know if I talked to you guys about this or not, Ira, but it's a way Linda and I got together and created this so that if that is a situation where a kid, where you're providing indirect services, everybody's documenting it the same way. Okay. So it could have not trickled down to everybody, but all right. So this is just a sample of what we call indirect services. All right. And basically, you're going in and you're saying, yes, the child is eligible for speech, but we're going to provide the indirect services because we're going to have either embedded goal, we're going to have a goal that we created, but I won't be the one that's monitoring the goal. So if you would, Amy, if you would enlarge the screen so I can show them. No, just make it bigger. A little bit more. I think you focused it, but still not bigger.
If you go down to the bottom with that magnifying glass.
Yes. There you go. One more, if you could, with the magnifying glass, or plus, yeah. Oh, I can't see it now. Okay. So scroll up to the top again. Okay. So this second paragraph, I wanted you guys to see, because even if you're saying it's an indirect service, the team still, that's better. The district team still has to meet annually for this child, or they can change it anytime by amending the IEP. These kids are still technically on your caseload. You're just not providing direct services to those kids. Okay. Now, okay, I'll answer that question in just a second. So this decision should be made annually. It may work for the kid. I think what happens is that people will put them on this delivery model and they never go back and look at it again. But you should be looking at this annually. You should be a part of the IEP meetings annually to determine if this is still the best model for this particular child. So if you do decide to use this model, if you scroll down for me, Amy, to consideration of special factors. In the IEP, you would go to consideration of special factors under communication. You guys are very familiar with this section. And it says, does the child have special communication needs? The answer is still yes, they do. So this is just a generic statement that we said, and I think we need to revamp it because Linda made it was a long sentence in there, so we just kind of need to revamp it. But it just says the student continues to be eligible for services as a student with a speech and language impairment. However, at this time, the committee members agree that the communication needs addressed within the present levels of academic achievement and functional performance, and the goals developed to address those needs can be met through other special education services and supports provided to the student. The speech language pathologist will consult with the appropriate school personnel as needed regarding communication needs of the student. That's why I talked about consult. Consult, you are not providing any direct services to that child. You may, in the plan or under support personnel, say, I'm going to meet with the teacher every quarter to check in to see if the goal that we developed for the kid is working. Do we need to tweak it? Are they collecting data? Because you're going to need this data when you come for the annual review again to determine if we need to continue with this. Under supports for school personnel, you're going to take that last sentence from the above paragraph and say, the speech language pathologist will consult with the appropriate school personnel as needed regarding the communication needs of the students. You don't have to put as needed. You can say every quarter. You can say every 6 months. I would advise you to do it often enough to where you can be able to monitor and you're not getting to the end of the year and you've only met one time and nothing's been happening. So that's why I just throw every quarter out there, but that doesn't mean that you have to do that. Okay. So this is just a good way of charting and documenting indirect services. The two things that I need to add on here are, one, in the present levels of academic achievement and functional performance, you still need to put whatever that student's needs are under the needs section. Like all of your speech information should still be in the present levels of performance, okay? Because you got to have a need to tie into whatever it is that you're doing with the child, even on the goal side or whatever you're doing, okay? The second thing that I have to add, and Linda and I talked about it, I just haven't had a chance. The second thing is under the service page, you do not put any services for speech, okay? Because you're not directly serving that kid, but their communication needs are being met. That's why I was trying to emphasize the importance between consult and consultative, okay? Now, consultative is direct services. I get this question all the time. Well, how should that look? Well, it depends on you. You can break the time up however you want to break the time up. Sometimes because we say it needs to be one segment per month, that's for FTE purposes, okay? There's no, if you don't have that one segment, you're not going to get FTE funding for the child. If you decide that your consultative is 30 minutes a month, that's fine. They can't stop you from doing that, but just understand you're not going to get them counted for FTE, all right? That 1 month, that 1 hour can be broken up however you want to. It can be, I used to do it 15 minutes a week, so I could just lay eyes on the child without, having them 30 minutes 2 times a month, and it's like a 2-month gap before I see them or a month gap before I see them, okay? Ira, you can go back to the presentation and let me answer this question in the chat. Okay, Randy, you had a long question. Let me go back to the other one. Jennifer, I'm coming back to you, Randy. I'm just joking. How would you recommend dismissing students who have plateaued or are no longer progressing? I think this is kind of like the first step to looking at this, because what I didn't add in about the indirect services, say you do this for a year or two and you got all this data collected, and then you go back and you say, well, let's look at eligibility again. That data can actually support you saying why this child doesn't really meet the eligibility criteria for speech and language, okay? I just say not to go into a meeting and you haven't really pulled any data similar to this and say your child is plateaued, so I'm going to dismiss them. At least this is a way to show that we've looked at another delivery model for your child. This seems to be working. He doesn't really need the direct services for a speech language pathologist. Those services can be, through that primary, exceptionality. We can't just go by what the test scores may be. Let's look at the data that we have. So that may be a way, Jennifer. Randy said, here it is. The student.
I was just showing you what I had it already. I got it from when I was working in Gainesville.
Look at, okay. I was like, oh, Randy put a long question in there. I'm sorry, I was just messing with you. Yes, this is what I want to happen. I want it to be like a wildfire and everybody's using the same thing, because it'll be consistent across the state. And, when you have those questions or they're talking about FTE or the documents being sent in, that's just great, because you have that information. So thank you, Randy, for using this and for posting that in the chat for me. That's awesome. Cheryl, who would you recommend we speak to about the dichotomy of determining eligibility between our pre-K community-based students and our on-site pre? I would talk to McCole Talley. Dr. McCole Talley Cheryl is our preschool or 619 coordinator. She would be the person that could talk to you a little bit more about the eligibility. It's not going to be much different, but I just don't want to overstep, because she has a chapter. If you guys go to the Godot website and go to special ed, and once you get to special ed, you'll go to eligibility. And when you go to, not eligibility, you'll go to the implementation manual. And under that heading is a chapter that has young children. She developed the young children's chapter. There's a section in there that talks about eligibility. but it's not much different from all of the other eligibilities. A few couple of steps that are a little bit different, but I think that will help you, Cheryl.
Okay, thank you. Yeah, it's just much harder to get them qualified for anything other than speech in the school setting. But when they're community-based, they're basically kind of screened for the overall. And that's just an issue that's cropping up a lot this year with these children that were nowhere for a year and a half because of COVID.
Correct.
Okay, thank you. I'll look at that. Appreciate it.
Okay, you're welcome. And I'm going to have to rush this. I'll talk for the last minute. Can you go to the next screen? And then I'm gonna have to jump off because they're starting this next meeting and I'm supposed to help her facilitate with the chats and all of that. Okay, LEA. The only reason I put LEA on here is that when Ira and I were kind of looking through the questions, a lot of people asked, you can advance to the next slide, Amanda. A lot of people were asking questions about Medicaid and budgets and why money is not allotted for getting more SLPs and different things like that. So what I wanted to state is that in the state of Georgia, the LEAs have local control. They have local control over their budget and their funds. They have local control over whether they want to bill for Medicaid or not. And if they do bill for Medicaid, Medicaid does not fall under Georgia Department of Education. It falls, I gave you the link to that. Or either you can go to Georgia Department of Community Health or Department of Human Services as far as guidelines for Medicaid in terms of billing and things like that. But as far as funding is concerned, even if, oh my God, I think people are signing on to the other one and it's just blowing my phone up. Okay. As far as, I think one of the questions was not having enough SLPs or for materials and things like that. That really is a LEA decision in terms of how those funds are disseminated. Georgia does not control that for the LEAs. They have their own local control. The only thing that we would do at Godot is that that's more of a budget thing. It's not even under special ed. It is, but it's not. It's still under budget. They just kind of monitor how they're using IDEA funds, just making sure they're not supplanting. And they're supplementing and not supplanting. That's the biggest thing. But I'm not going to even dive into that because that's more of a budget kind of conversation. But I think I just wanted you to know that Georgia Department of Ed doesn't have any control over budgets and funds and how they use the funds, from that standpoint. And that was it for me, Ira.
Thank you so much.
I'm just so I was just so sorry that I had to it says, can Godot able to enforce caseload caps? We're gonna get into that because that's, if you guys could see my board or the board that I had at Godot, that was one of my things. And I've been going back and forth about that because that rule that they have there is being looked at, okay, about personnel. So I wouldn't be able to dive into that. I can't say that we can enforce a cap, but I think they're looking at that guidance now. So hopefully I can have some input and be a part of that team to kind of look at that. But it takes a minute to change rules. There's a whole heap of processes that you have to go through because some of these rules and guidelines have been in place forever and it takes a minute for it to be changed. So just know that that is one of the things that's on my strategic plan to kind of look at the caseload caps and different things like that and what it really kind of means because different people have different interpretations of it. Okay. You are welcome, Xavier or Javier. I'm not sure how they pronounce it, but I think it's both ways. Okay. So what I'll do, if you have additional questions, send them to Ira and I will definitely reach back out to you guys, but I do have to hop off so that I can help my coworker with her next meeting.
Thank you so much, Evelyn. We appreciate you.
Thank you so much.
You're welcome. Thank you guys for having me. And you guys enjoy the rest of your day, okay? Okay.
All right, team. So I know it's only 2 minutes before 1:00 and we are scheduled to end our session at 1:00. We know you have students to see, meetings to attend, all of the above. But before you go, we had a couple other things. We wanted to go over virtual classrooms, and we wanted to be able to share some resources. So what we can do is go ahead and get those resources out to you. But we are having a fireside chat on our next scheduled fireside chat is on February 25th. So what we can do is move the section for the virtual classrooms to the fireside chat, and we hope to see all of you there. It is just an hour-long fireside chat at 9 a.m. on February 25th.
All right, and everyone who's registered today, I will send you the registration link for the fireside chat so that you can get those invitations each month. And hopefully what we can do is virtual classroom the next time, and maybe talk about creating that folder for a resource share. So everyone participating can kind of have a folder to throw some ideas and resources into.
Awesome.
Are we
Thank
still
you.
meeting Friday? We're still meeting Friday, right?
In our district?
Yes.
Yes.
Okay. Just want to make sure. Sorry.
Yeah, these will be the coastal GLRS fireside chat. So that is everyone in our 7 counties who is an SLP is eligible to come. And we have been doing them, but now that I have so many of you registered for this event, I'll be sending out registration links. They're completely optional, but we definitely appreciate having a variety of schools and experiences involved.
So just to let you guys know, the next fireside chat is February 25th. And then after that, we'll have another fireside chat on March 25th. And then in April, it's on April 22nd. And then we have another consortium event on May 4th to end the year during Speech and Language and Hearing Month. So thank you so much for everybody that was able to attend today. We appreciate you. And in the meantime, if you have any resources that you would like to share, your one resource that you just wish every SLP knew about, if you can share that information with me, I will put my email address in the chat. Because this is all about us collaborating with each other. So if there's something that you can share that will help someone else, please let us know. And it is 1:02 now. So again, thank you everyone for joining us today. And we hope to see you on February 25th.
All right. Thanks, everybody.